All right. Well, hello. Welcome, everyone. Good afternoon, good morning, depending on where you're coming from. I want to thank you for joining us for Welcome Wednesday, which is our Get Interested in Society for Health Psychology Interest Groups event hosted by SfHP's Membership Council. I'm Jenna Anderson. I'm the chair of the Membership Council. And before we begin, I just have a few items to share. So today's presentation is going to be divided into a couple of parts. So in just a few minutes, I will introduce SfHP President, Dr. Stephanie Fitzpatrick, who will have some introductory remarks. And after that, I will very briefly highlight some of the benefits to membership in SfHP. And after that, we'll have each of our interest group chairs and representatives who are here introduce themselves and their group. And then you'll have the opportunity to choose which of the breakout rooms you would like to join first. Right. So you may, of course, stay in the same room for the duration of the event, but we also really welcome you to move between groups at various intervals if you would like, right? Get a chance to see some of what, some of your colleagues and peers are doing that may not actually be part of your day-to-day, but that might pique some interest. As you can see, portions of this event are going to be recorded, right? So anyone who speaks, for example, to ask a question during this introductory portion or at the end is agreeing to be recorded and granting permission for that recording to be posted on the website. But when we move into the breakout groups, recording will be stopped. There will be a brief return to the larger group for questions at the end, and you can certainly send them by chat or just indicate that you would like to ask a question at that point. So with all of that said, now I am pleased to welcome Society. Oh, wait, am I moving out of turn? Sorry, these are the interest groups represented today. So unfortunately, Women's Health was unable to attend, but everyone else has a representative here for you to speak with today. And so I'll have these individuals introduce themselves after we hear from Society for Health Psychology President, Dr. Stephanie Fitzpatrick. Stephanie, thank you for being here.
Thank you, Jenna, and welcome everyone. Welcome to our new members of the society. Great decision. I know we have a lot of resources to offer you all, certainly from our councils and committees to our webinars with CE credits, and even more importantly, to our interest groups, which are continuing to grow and meet the needs of our members and cover really important topics within the realm of health psychology. I have been a member of the society since I was a graduate student. So I've been around for about 20 years, a long time. And I keep coming back because of the relationships and networks I've been able to build, but also the resources I've been able to receive from being a member of this important society. So again, welcome, and I hope you all get engaged and feel really intrigued about some of the great work that our interest groups are doing. Thank you.
Thank you so much, Stephanie. All right, so at this point, I'm just going to very briefly go through a few of the member benefits, not all of them, right? The list is much more exhaustive than this, but a couple of reasons why you would want to be involved in SfHP if you aren't already, or would want to tell your peers and colleagues about. So it allows participation in up to 12 general and topic specific listservs, which is good for engagement and feeling supported. Health psychology themed webinars, including free CE programming. This is one of my particular draw areas. Graduate student and postdoc grants for research, clinical practice, and leadership. Monthly publication of Health Psychology, the official journal of the Society for Health Psychology. Awards and recognition, be keeping these in mind. Think about people who, you might want to nominate, including yourself. So awards in research, clinical practice, mentoring, education, training, career service, and volunteer service. expanded engagement in diversity, inclusion, and equity initiatives, upgrading and expansion of the SfHP website, including trainings, resources, and a job and fellowship board. If you all have not visited the new website, I strongly encourage you to do so. It really came together beautifully. Leadership opportunities in councils, committees, and interest groups, which maybe is why some of you all are here today to learn about some of the opportunities in these groups for leadership. And of course, the social and professional value of networking and advancing the field of health psychology. Okay, so how do you get involved, right? All of these questions. Are you a member of one or more of the interest groups or specialty listservs? Would you like to become more active in a council or committee? I will put a plug in right now for membership. We are recruiting a couple of members ourselves. Can you volunteer for a time-limited task like reviewing program submissions or writing an article for the health psychologist? And are you or a colleague eligible for one of our many awards? Like I said, be thinking about the people that you would want to honor and highlight. So this is where you find your home within this professional home by finding activities that really are going to help you grow and advance in our very important field. Also important to note, we are a one-fee membership model. There are no extra charges associated with this membership. So essentially when you join, you pay one fee for the year, and then you enjoy at least a full year's benefits. Sometimes it actually extends beyond without any extra charges for any of the webinars, the CE credits, the listservs, award submissions, or any other benefit. So then again, also, who do you know who should be a member, who's not, right? Invite your colleagues, invite your peers, invite your students to join. New members who join now actually will enjoy benefits immediately for the rest of 24 and all of 25, right? So a little more bang for your buck if you join today. And you do not have to be a member of APA to be a member of the Society for Health Psychology. Very important. All right, with that, what you all actually came for, right? To meet the individuals representing these interest groups. And so what I thought I would do is have each of our interest group chairs or representatives introduce themselves, maybe going through as it's listed here. So beginning with adolescent and young adult.
Hi, everyone. My name is Zeba Ahmad. I'm a clinical and research psychologist, and I'm the chair of the Adolescent Young Adult Interest Group for this term. We are focused on advancing health in adolescents and young adults, which we define really broadly as people aged 12 to 39 years old. We have people who specialize in pediatric care and young adult care, people who are interested in research. We work across chronic health conditions. We have a lot of people interested in psycho-oncology, but also people interested in healthcare, such as care transitions and doing things like enhancing access to psychotherapy for young people. So really welcome and would be happy to speak with anyone who's also interested in adolescents and young adults. We have leadership opportunities available on our board and would be happy to discuss further. Thanks.
All right, so I think next would be CL Psychology. I don't believe we have a representative from CL today. Is that okay? So we will move over to eating disorders and body image.
Hey everyone, so I'm Christine Selby. So the Eating Disorders and Body Image Interest Group is brand new. We have not really done much yet. I'm going to be meeting soon with the core people who are really involved in getting this off the ground, and be sending a message to the general listserv soon to get people onto the specialist listserv. But realize I didn't say anything about who I am. So I'm a counseling and sports psychologist and a certified eating disorder specialist. So my focus is I'm also a professor at a university. I have a part-time private practice, mostly focused on eating disorders. And so we thought this was a really good home for the interest group because it's a multidisciplinary subspecialty of psychology involving nutrition, of course, psychology and medicine. So yeah, totally happy to talk with anyone who's interested, including some ideas that we have. We hope to get off the ground, and any ideas you may have as well that you'd be interested in contributing to. So looking forward to talking to folks today.
Great, thank you. How about integrated primary care?
Hi there, everyone. I'm Chase Gross. I am a clinical health psychologist. I'm director of behavioral medicine at Atrium Health Floyd. So, really, I do integrated primary care and while I'm training family medicine residents. Our Really, the group is, we have a couple of subcommittees, several leadership positions, and the group is really there, exist to help people at kind of all levels of their development, right? So either early career, or you're just coming into the IPC after, being out in the workforce somewhere else. It's there to help develop integrated primary care and kind of continue that reach. So look forward to speaking with you. Thanks.
Terrific, thank you. International research and collaboration.
Hey, good morning or afternoon, all. I'm Ron O'Donnell, a clinical psychologist and professor with Arizona State University and their Doctor of Behavioral Health program. I've been doing consulting globally, training conferences, workforce training, small research projects in China, Southeast Asia, more recently South Asia, and now Africa, and looking to find other like-minded group members of this group, students or researchers, clinicians who want to extend their work, either from what you're doing locally to global reach, or if you're already doing some global work, to join up and try and combine resources and find some synergies to work together. So our goal is to promote global health, global integrated healthcare among this group, and I look forward to talking to more of you later on.
Excellent, thank you. Lifestyle medicine.
Hi, everyone. I'm Larry Miller. I'm the chair of our Lifestyle Medicine Interest Group. Much like Christine's interest group, it got launched earlier this year, and so we're newer into being an interest group, but we were designed because lifestyle medicine is one of the fastest growing medical subspecialties, and it's important for clinical health psychologists to be part of the table and utilizing our expertise in psychological science to promote health, prevent illness, and improve health services and systems. I serve as an associate professor at the Medical College of Wisconsin and also the associate training director of our health psychology program. And really, I'm seeing kind of at the ground level the impact that educating the new workforce in health psychology and in particular lifestyle medicine approaches, the impacts that can really have on patient outcomes. So I'm super excited to lead our group to help expand the expertise in health psychology for the field of lifestyle medicine. Our goals as an interest group is to promote awareness and advocacy, to network and collaborate, to develop a set of best practices, and to create sub-interest groups. And our priorities for this coming year are to grow our membership, develop virtual programming. In May and June, we'll have a webinar that we're hosting, and then I'm also working to develop our website and creating professional resources. So welcome everyone to join the group to learn more about what we can help with and ways that we can best serve you and help you with your needs.
Great, thank you. And pain psychology.
Hello, my name is Dan Bruns. I'm the chair of the Pain Special Interest Group. It's a group of about approaching 350 practitioners and researchers who focus on the treatment of pain. The group has been involved in a number of efforts. You may have seen yesterday there was an email on the listserv about a new 7-hour pain CE that is now APA's kind of official intro to pain psychology webinar. And we hope to develop more of those. We're talking with APA about developing a whole curriculum for pain psychology, which is the first module. We've also been involved in various projects. Just a couple of weeks ago, there's this big AMA reference work that a group of about 30 of us worked on revising to include pain psychology concepts. And so, so there's an opportunity to become involved in sometimes small or sometimes larger projects. And so those are the things we've been involved in. And we're welcoming anybody who has an interest in the assessment and treatment of pain.
Fantastic. Thank you. Thank you all so much. With that, we will move into the breakout room portion of this event, where I will, sort of again encourage you all to find the spot that you would like to start in, and of course, welcome to stay there, but also welcome to move, from room to room and talk to various folks about their interests and what they're doing relative to our special interest groups. I'll give it a sec. Or any comments from anyone about sort of the work that you all talked about?
I can share. So this Christine Selby, eating disorders and body image. It was just great to connect with like-minded colleagues, and we found that we were talking about things we could do in the group, but also just kind of venting about the where things are with our particular interest area. So it was nice to connect with colleagues and just to hear the like-mindedness, the interests, and of course ideas for what we might do with the group moving forward.
Terrific. Thank you, Christine. Anyone else? All right. Well, in that case, I want to thank everyone for attending this event today. I'm so glad to hear that people were able to connect. And a big thank you to our president, Stephanie Fitzpatrick, for her opening remarks, and all of our chairs and representatives who came today to talk about their work. I think there's a lot of great sort of output coming from our interest groups, and I'm thrilled that there were good conversations and people were able to make these connections today. So as mentioned, if you have any follow-up questions after this, please don't hesitate to reach out by email. And thank you for having. Yay! I'm so glad that people enjoyed the breakout rooms. Don't hesitate to reach out, and we will look forward to seeing you at future events. Take care.
Thank you.
Thank you.